members of council, thank you for this opportunity to speak about Sydney District Hospital emergency room located in Wallaceburg. I am assisted here this evening by Lindsay Anderson, a local Wallaceburg lawyer, who also happens to be my daughter, along with a lot of friends that I brought from Wallaceburg and the area. I have a lot to say and only 10 minutes to do it, so let's get to it. My message to the people of Chatham, Blenheim, Ridgetown, Tilbury, and surrounding areas is that the closure of the ER in Wallaceburg will also affect all of you in a very negative way. The current ER wait times in Chatham are long. In fact, longer than Wallaceburg. I have phone messages, letters, emails talking about wait times in the Chatham ER of 6 hours, 9 hours, and much longer. Cases of waiting to see an ER physician and getting the test done that take 11 hours. There are over 23,000 visits per year to the ER in Wallaceburg. If they close our ER, most of these people will be coming to Chatham. So you think your wait times are long now? Close our ER and see. This past Saturday evening, the Chatham ER was in crisis, with an overflowing and standing room only waiting room. The Chatham ER called and sent patients to the ER in Wallaceburg. If our ER is closed, you no longer have that alternative for the Chatham ER. You should be concerned, very concerned. Our issue is also your issue. In the Hay report, the Wallaceburg and Victoria ER patient volumes were compared to 16 other comparative hospitals in Ontario. Rural versus rural. Small community versus small community. And it's interesting that the Hay group never mentioned these conclusions, which I'm about to share with you. For CTAS level 1 patients, the most critical, Wallaceburg ranked in the top 6. 200% higher than Victoria. For CTAS level 2, Wallaceburg ranked number 2. Believe it or not, 2,000% higher than Victoria. CTAS level 3, Wallaceburg was in the top 6. 135% higher than Victoria. We've all heard that no decisions have been made. But you know what? It is an insult to everyone involved in this issue for the LHIN to be telling us that no decisions have been made. That this is not about the money, and that they are engaged in community consultations, while the Chatham Kent Health Alliance goes around making cuts and making decisions that are undermining our efforts to keep the local ER in Wallaceburg open. In fact, the Deloitte study commissioned by the Chatham Kent Health Alliance says the Chatham site is in deficit, and one way they can save money is by closing the Wallaceburg ER.
Bingo.
I would just like to reiterate that the hospital in Wallaceburg came into the Chatham Kent Health Alliance with no deficit and operating in the black. Did you know that the Wallaceburg ER has never had to get a doctor from the Chatham site to cover a shift in Wallaceburg? Never had to get a doctor from the Chatham site. If there is an open shift, the 9 doctors work out a solution amongst themselves, and the schedule is done months in advance. Yes, we do use some out-of-town doctors, but you know what? Chatham uses more. When Ken talked about the Chatham Kent Health Alliance is the largest user of Health Force Ontario, which is out-of-town doctors, that's the Chatham site. You don't use Health Force in Wallaceburg, they use it in Chatham. So when he said Chatham Kent Health Alliance, he meant Chatham, not Wallaceburg.
Yeah.
In the case, those out-of-town doctors that we do have provide excellent care and enjoy working at the ER in Wallaceburg. If the ER closes, 8 of 9 doctors are quitting, and with no ER, good luck recruiting replacements. By the way, I was told that one of the young doctors, soon to come out of the Rosemary Mill program, has said that he wants to work at an ER. And if there's no ER in Wallaceburg, why should he go there?
Yeah.
Lindsay Anderson has agreed to form a committee of local people to help recruit doctors specifically to Wallaceburg. I just want to talk about liability for a minute. If you close ER in Wallaceburg, the Ministry of Health, the LHIN, and the Chatham Kent Health Alliance will be open to huge liabilities as soon as that first patient has an adverse outcome or dies as a result of no ER in Wallaceburg.
Yes, sir.
It will happen, and you know what? They'll use your tax dollars to pay for the lawsuit.
Yep.
In conclusion, healthcare is not just about dollars. It's about people. The province of Ontario created the LHINs that hide our elected MPs from responsibility. the Ministry of Health, in turn, shorts the funding to the LHIN. The LHIN then chews up an additional $4 million in administrative costs. Then they shortchange the Chatham Kent Health Alliance. We have a plan to deal with physician recruitment and the physical plan issues. We have community support. We have done incredible things for our hospital in the past, so leave our ER open. We will work with you to make an ER that will not only provide critical care for our communities, but also make it a model for the rest of Ontario. However, if you decide to close our ER, there are no limits to what we will do to get our hospital back and our ER functioning. Lindsay and I have petitions containing 10,400 signatures for the Mayor to present to the Minister of Health. These signatures come from Wallaceburg, from Chatham, from Walpole First Nation, Dresden, former Chatham Township, Dover Township, Camden Township. They come from all over.